our GP, but not every ailment requires seeing a doctor. You could save yourself a lot of time and trouble by visiting your local pharmacy.
As qualified healthcare...
That didn't help then, did it?
Put them back on. As qualified healthcare professionals, pharmacists can help with a range of health concerns. And here to explain more is pharmacist Nyrah Saleem. Good morning to you.
Good morning.
What is a pharmacist? Tell us, what do they do?
Well, in simple terms, we are experts in medicines, and we have been first line throughout the pandemic to answer your queries as well as just dispense your medication. The whole topic of, what is the role of a pharmacist is such an important topic because there are a lot of people that are unaware of what a pharmacist actually does and how the pharmacy can actually help them. There is that stereotype that pharmacists are just, they count medication behind a counter, wearing lab coats, but really our roles have really revolutionised and changed with time, Not only are we familiar with the medication, but we do have that necessary training and qualification to manage minor illnesses and really monitor patients with long-term conditions.
We're a little bit behind the times here because in Europe, certainly in France, that's your first port of call. You go and see your pharmacist. And so people coming to see you, I'm assuming, could save themselves a lot of time if it's something a little simpler, that they could come and see you first before booking in to see the GP.
Yeah, no, they definitely can. There's so many minor illnesses now that, a lot of pharmacists can help you with. And just a bit more about the pharmacy role in itself is actually changing now. There are a lot of pharmacists now working in GP surgeries. So I'm currently a clinical pharmacist who works in a GP surgery in Essex. And I work alongside doctors, nurses and paramedics to help manage medication a bit more closely. And just touching on some of the minor illnesses, your community pharmacy can help you with. There's loads of different illnesses. There's sore throats, there's constipation. Anxiety's been a big rising issue throughout the pandemic as well.
Can help with that as well.
And that's something definitely we can help with.
And so, as far as... Because you can't write a prescription, can you?
At the moment, I'm actually doing my prescription course. So, hopefully,
so some pharmacists might even be able to write a prescription for you.
Exactly. Minor health clinics and actually write prescriptions for antibiotics if they're needed. And, the overuse of antibiotics is currently a really big problem. Sometimes antibiotics may not even be needed. So I would always advise to patients, if you're having a cough less than 3 weeks, always seek over-the-counter advice first before speaking to your GP.
Whenever my mum was ill, literally, whenever she was ill, she wanted antibiotics. She would go to the doctor and say, I need antibiotics, but you don't need them, do you?
You don't. Sometimes it might do more harm than good. You do have antibiotic resistance where antibiotics may not even be working against the infection, so definitely seek over-the-counter advice first.
You can also offer reassurance as well, can't you?
Definitely. You can always speak to your pharmacist in a medication review. So, the good benefits of medication reviews, it allows you to actually sit down with the pharmacist, go through your medications a bit more in detail and go through any health-related queries that the patient have. A recent stats actually revealed 30 to 50% of patients actually don't take their medications correctly according to prescribers' instructions.
Really?
So, how many of us pick up a prescription but don't even start or finish the medication? This is a great example where pharmacists can actually intervene, find out reasons why someone might not be taking the medication to help improve the overall control over their condition and hopefully reduce the risk of any hospital admission. The NHS ambulance service that's currently under a lot of strain at the moment. A significant proportion of A&E calls are actually the result of falls in the elderly, and that could be the result of just their medication. And just by reviewing or changing their medication, I strongly believe we can actually reduce the risk of any falls or fractures in this age group.
A lot of people might also be concerned about privacy. You go to your doctor, you go into the doctor's in the actual room and you sit down in front of them. Obviously, a lot of it's online at the moment, obviously. But what about privacy with your pharmacy?
Yeah, so, the good thing with a lot of community pharmacies, they do have that private consultation room, so you can speak to the pharmacist in a one-to-one private manner and there will be, loads of confidential information that's stored in that room and not taken out.
What about this new scheme? It's the referral scheme. What is that?
Yeah, so it's actually a new community pharmacy referral scheme made by the NHS. Now, its aims was actually to help GP surgeries refer patients with minor illnesses, you know, such as your sore throat, to local community pharmacies for a same-day private consultation. So instead of seeing your GP, you can actually book a consultation with your local pharmacist. Your pharmacist will then clinically screen your symptoms, either reassure you or advise you on over-the-counter medication to buy. The main benefits of the scheme is it's really helped to reduce GP waiting times, freeing up appointments and allowing GPs to focus on more complex cases. And just to put things into perspective there, you know, currently over 10,000 patients a week now are being referred to their local community pharmacy. And that would really help, you know, reduce the burden on a lot of GPs out there.
What about things like blood pressure checks or cholesterol checks, stuff like that?
Yeah, there's loads of additional health services that your pharmacy can help you with, especially to help patients with long-term conditions. You know, there's the blood pressure checks, cholesterol checks, weight management service as well. There's also been a lot of change in drug legislation now as well as being able to buy weight loss medication over the counter. You can now even buy regular contraceptives, desogestrel, for children over the age of 18. And now I think there's even discussions being made about making hormone replacement therapy available without a prescription. And that's going to be life-changing for a lot of women going through the menopause.
What does it cost? Is it free?
At the moment, they haven't come up with the cost yet.
So
But hopefully...
get in now whilst it's free.
Get it now whilst it's free. Hopefully, you know, there is some more information about the hormone replacement therapy.
Yeah, of course. Well, that isn't free, is it? I mean, there are, you know, sort of issues with that it's been...
Yeah, there's a lot of stock issues at the moment with a lot of hormone replacement therapies. You know, a lot of the patches are currently out of stock.
But as far as general going in to see your pharmacist is concerned, then that's a free service.
That's completely free. You know, the pharmacy referral scheme is a free scheme and it's eligible for all adults and children over 1 year old.
And, of course, obviously, you would recommend if someone needed to go back to their GP, wouldn't you?
Definitely. You know, we can differentiate between mild and more severe symptoms, and we do know when we need to refer you to the appropriate healthcare professional.
Lovely. Thank you.
Thank you so much.
Thank you so much.